everybody, welcome back to my YouTube channel. My name is Providence and I talk about OSCE, everything about OSCE and your journey to the UK if you're an overseas nurse. So sit back and relax. So for today, I'm going to be talking about those common mistakes that fail people during the OSCE exam. All right, there are some little things that you might overlook or you might not think is important, but those are important enough to make you have a receipt in any of the stations. Okay, so if you want to learn about those mistakes, sit back and let's get started. All right, what are those common mistakes? There are mistakes that are costly enough. It can be pardoned. Actually, some can be pardoned while some cannot be pardoned. There are some red flags that you must avoid. So the title of this video is those common mistakes that you must avoid during your OSCE exam. So first of all, starting with the assessment, I'm going to mention the several mistakes you must avoid in your assessment. During your assessment station, this is where you be assessed on your verbal and non-verbal communication. When you go to do your vital signs and record your vital signs using the new scoring assessment tool or the GCS or whatever tool you're using for your assessment. Now, the mistake you want to avoid making is, don't forget, make sure you ask the patient for allergy if they are allergic to anything, and if they are an assess, also check the allergy band. If they're an allergy band, identify it, and also try to find out what the reaction they have when they take a particular thing that they are allergic to. Don't forget to cross-check their names with the names on their wrist band. Okay, don't forget to, for those doing the new test of competence, don't forget to complete your A to E assessment. Don't jump anything. The examiner knows when you make a mistake. If you mistakenly jump, make sure you go back and refer back to it before the end of that station. When you're through and when you're checking the vital signs, please count the radial pulse for 1 full minute. Don't assume. The examiners, they already know the vital. If you're using a live patient, they've already checked these vitals even before you enter the exam hall. Make sure you count manually. Don't use the pulse, the reading in the SFIG, in the digital SFIG. Count it manually for 1 full minute. Then you count the respiration for another full minute, making it 2 minutes. Then when you're checking the blood pressure, don't forget, you must mention, verbalize everything you're doing, verbalize your process. Don't keep quiet, because they are assessing your verbal communication. So all those things you will say in your mind, say them out. Make sure you carry examine along every step. What you're doing, say it out. Okay. And when you want to check the temperature using the tympanic thermometer, don't forget to assess the ear before you put in your probe. Now you're done with your assessment, your vitals, and you want to record using the news scoring, the news chart. Don't forget to identify the level of alertness of your patient. If your patient is awake, don't forget, an alert, don't forget to identify. If your patient is on oxygen, you can ask the assessor to confirm the how many liters of oxygen your patient is on. Make sure you identify it. Make sure you the first thing you need to do is write the date, sign, you put your initials, don't forget. Then you follow it in order, trace it, don't miss any step. Make sure you score your chart very well. I'm going to make another video on how to properly to chart your news, to do your news scoring. Okay, this mistake can make you come back if you forget to identify A for a patient as alert. You can fail that station. So chart properly, trace it properly. Don't forget to, when you're done tracing, when you get your score, turn to the back of the news chart. At the back, you will see the escalation plan. You don't need to cram anything. Use the escalation plan and write the plan accordingly, depending on the score that you get. And don't forget to sign your initials. So that's for the assessment. Move on to the planning. The planning is where you do your nursing diagnosis. You're going to identify two nursing diagnoses. Okay, identify two relevant diagnoses. The first thing to do once you about to document, first thing, write your name, write the date, sign where applicable. Write your name, sign, and write the date. Don't forget. When you write the diagnosis, put the aim, then you give your interventions. Okay, and mind you, when you're doing your planning, try to avoid patient this, patient that. Don't refer to your patient as patient. Always acknowledge them by their names. For example, if you want to do the intervention, don't say patient this, patient is experiencing, or patient was given this. No, use their name. For example, Miss Mia was given this was given to Miss Mia. State their name and make sure you identify at least three relevant patient self-care, three relevant self-care, at least three to you identify. I'm still going to make another video on every step of how to make it. Then when remember, you don't have much time. It's 15 minutes. You don't have time at all. You have to be as fast as possible and write correctly. Make sure that your handwriting is clear and legible. Try to write what somebody can read. Don't use any abbreviation that is not popular. Okay, write legibly. All right. Okay, that's about that. Let's go down to the implementation is where you minister your medication to your patient. For example, because this is a scenario based station, so in the scenario that you're giving, you do your assessment. Any case you're giving, that's what you use throughout these API stations. For example, if you're giving a CCF in the assessment, you know that all through your API, everything is going to be related to cardiac failure. So in the implementation, you're going to give medications for this CCF. Now, if you have CCF now you're going to give medications. For example, if you are giving digoxin or furosemide in the implementation. Now, in this station, make sure that before you give any medication to this patient, this is a heart patient with heart problem, so you need to make sure that you have to check the blood pressure before you give your medication. You have to check for the pulse. Any medication you're giving, make sure that you adhere to educate the patient on the side effect of medication and also know what the medication is known for. If you're giving furosemide, don't forget to check the blood pressure before you give the furosemide. If you're giving the digoxin, don't forget to mention that you need to check the pulse. If the pulse is less than 60, you will not give. And make sure that before you give any medication, you have to assess that the patient is able to swallow. You check for the expiry date, or make sure the expiry date is still valid. The medication is still intact, the packaging is intact, and there's no breakage in the package. Is everything is clean and safe. Then before you dispense the medication, mind you, as you're reading your prescription, read it out loud so that the examiner can hear you. Say everything you're doing. All right. As soon as you give the medication, and don't forget your rights of medication, the right patient, right dose, or do your 6 rights of medication, because here they're going to assess you on how you can safely administer medication to your patient. Make sure you read the instructions carefully. Make sure you read the instructions carefully, because if you don't read the instruction, you can make a very costly mistake. All right. And if you make a mistake, don't forget, verbalize your mistake and say what you would do in the normal hospital setting. All right. Okay, when I had my own OSCE, I almost made a costly mistake because I rushed through the prescription, and I had in the start medication, patient was prescribed this furosemide for 10 a.m. Then in the regular medications, she was also prescribed furosemide for 1 p.m. And I dispensed I was to administer the 1 p.m. medications. So I dispensed the 1 p.m. medications and gave to this patient. It was later when I realized that this patient this patient has already been prescribed and was given furosemide by 10 a.m. Only from I told the examiner that that I've made a mistake. Oh. Examiner was like, what mistake? I was like, this patient has furosemide by 10 a.m. She said, am I sure I should check? I then checked. Then I found that the one 10 a.m. was for yesterday. And I was given today's medication. So imagine what would have happened if it was actually today that it was given the morning of today 10 a.m. and I gave it again by 1 p.m. That's a very costly mistake that there's nothing you can do about it than to fill that station, because it is it has an effect on patient safety. Okay, so you have to be careful, read the instructions carefully, read your prescription carefully before you administer. Okay, and if you make a mistake, try to verbalize a mistake. Try not to overdose a patient. If you're not sure of any medication, that's why you have the BNF. Yeah, you can have the hard copy or the electronic just by your side there. You open it, click on it, type the name of medication, then you would read the indication, the dosages, the side effects, everything in it is there. Okay, there's no cause for alarm for that. Now moving on to the evaluation station. Here is also a silent written station. Like I said earlier, first thing you need to do, write your name, sign, write the date. Very important. That's the first thing you will do before you start writing any other thing. Write your name and sign. Here also make sure that your handwriting is clear and legible. Okay, for the old OSCE, you're going to write here. You're going to at this stage, you're going to have access to the charts you use for your assessment plan and implementation. You're going to have everything here in the evaluation station. Okay, it's just for you to transfer your care interventions from your care plan to your evaluation. You just to write them in past tense for the old OSCE, and we'll do another video on how to do this, please. Then for the new OSCE, the new OSCE, your assess on your ability to hand over your patient. You're going to hand over your patient safely to your examiner. So you're going to be assessed on what you write. Okay, so you have to make sure that you're stating you have to say what is actually required in the handover. Okay, you have to state a realistic plan of care, because you cannot hand over your patient haphazardly. So you have to be specific and give a realistic plan of care of what you're handing over. All right, use a clear verbal communication, or I say what your examiner will understand. All right, and make sure that your system of handover is structured and is systematic. Okay, so now moving on to the clinical skills, the errors you make. Lack of communication, like I said earlier, the access on your verbal and non-verbal communications. Make sure you speak out very well, speak out loud. Okay, they'll tell you speak out your thought bubbles, all those things you're thinking about in your mind, say them all out. Okay, yeah. Then read the scenarios very well, the questions and instructions, follow instructions. All right, don't contaminate your sterile equipment. For those doing that will be doing the ANTT, try not to contaminate your sterile field. But if by any chance you contaminate your sterile field, always verbalize what you've done and how you go about that in the real situation. For example, if you use your sterile glove, so you're supposed to use for the dressing, you're supposed to use to maybe use a sterile glove when you have not um arrange your instrument. You use it to remove the dressing. In this case, you can ask the examiner if you say examiner, in real sense you're going to get a new glove, so ask examiner to get you a sterile glove, in separate sterile glove for the dressing. Or if you forgot to pour your solution to your sterile field before you started the procedure, you ask examiner to assist you in pouring the solution that you forgot to pour it. But make sure you tell them what to do. You have to tell them to use the alcohol wipe and wipe the mouth for 30 seconds. Allow them for 30 seconds before pouring into the sterile fluid. Don't assume they know. Tell them what to do. Okay, make sure that everything you do, you have to read the marking criteria. All right, you have to be careful. Practice. The only way to avoid mistakes is constant practice. Make sure you practice very well. Get someone that you practice with. Get someone that will assess you. Practice with your pillow. Practice, practice, practice. All right. For every procedure, and that mistake that is common is not gaining consent. You have to gain consent for everything. As long as you're touching the patient, before you touch this patient, make sure you gain consent from this patient. Tell them everything you want to do. Gain consent before you proceed touching the patient. All right, make sure you complete every station within the time frame. Sign and date every documentation. That's the first thing you need to do. I forgot to mention during implementation, as soon as the patient has taken the medication, next thing is go and document it before you start giving the health education or other things. Make sure you document. It's better to finish documentation and be cut short while you're talking, because you will be marked on what you write and not what you say. So mind what you write. Be careful. That's most important. Okay. During the BLS, make sure that the chest compressions, you're pushing hard, you're pushing fast, and you're allowing for full chest recall, and you're working according to the time, and all right, you're working according to the time. You know, if it has to do with time. Okay, and don't make all those incorrect documentations. Try to limit. Write legibly. Write what. Avoid writing jargon. Okay, yeah. And for those that have to do with the calculations, please, if you're calculating, be careful, especially for those that will do the fluid balance and others. Please be careful in your calculation. All right, you'll be provided with a calculator, so you have to be careful with your calculations. Remember, this is a test of patient safety. So anything that you do that will have a negative effect on the patient, avoid it. If you're doing a procedure, ask yourself, how can I maintain safety for this patient? That's the right way to go. Anything you do, make sure you carry patient along in everything. Try to avoid avoid safety in medication, safety in sharp disposal, safety in everything. Check for allergies. That's also safety. Make sure gain consent. Make sure it's safety, because it's very important to this patient. All right, so I hope I've been able to cover most of these common errors. Okay, if you have any questions, you can pop them up in the comment section. I will always answer your questions. All right, OSCE is something simple. Anybody can do it. You can do it. I was able to do mine and I passed by the grace of God. So if I could do it, you too can do. You too will do it. So you have to be careful. Make sure it's constant. Make sure you practice. It's constant practice. That's what you do. That's what you need. Constant practice. All right. So thank you for joining me today's class, and I'll keep begging you, please subscribe to my channel. Okay, and I'm going to do more videos for you. Please try to like and subscribe and share and refer people to us. Okay, all right, thank you, and I wish you all the best in your OSCE exam. Okay, thank you. Bye.